Hi, myself Dr. G.S. Jammu. I'm a bariatric surgeon in Jammu Hospital, Jalandhar, and here we are doing bariatric for the last 10 years. And I have with me my dietitian, Mr. Rajni Sharma, who's young, energetic, and very talented dietitian as for this bariatric thing is concerned. So the purpose of making this video today is to educate the masses about what all bariatric surgery is about, and they clear the myths related to the diet after the bariatric surgery, how you can have a good protein-rich diet, for which Rajni Sharma will be talking. To start with the topic, bariatric surgery or the weight loss surgery is not a new thing. It has been done globally for the last 40 to 50 years. The first surgery was done probably in the US in the year, I think, 1966. And since the incidence of obesity has increased globally, and particularly in India is also now in the grip of obesity. To tell you that the state I come from, that is Punjab, is the most obese state in India in the statistics of obesity. In India, we have about 9 to 10% the incidence of obesity, and in Punjab, we have the incidence of obesity as high as 35%. So coming from the most obese state of Punjab, because of the rich diet pattern of the state and some genetic reasons, the obesity has increased exponentially. So this bariatric or weight loss surgery is for those people who are not able to shed off their extra kilos with normal diet and exercise. And you know, the increasing weight, the increasing burden of weight not only reduces their quality of life, compromises their quality of life, it reduces the number of years, and obesity along with that brings with it so many diseases, amongst which the common ones are type 2 diabetes, high cholesterol, snoring, sleep apnea, and joint pains, and to some extent even infertility. So in our center, Jammu Hospital, Jalandhar, we are doing basically all the procedures. The most common procedure which we do here is mini gastric bypass, which was started in the year 1996 by Robert Rutledge in USA. Basically, mini gastric bypass procedure is a combination of two things, which is a sleeve, that is, we make a small pouch of a stomach out of a big stomach, and the second thing, we bypass some part of your absorption, which is in the small intestine, that is, we bypass your duodenum, so that even if you are eating more or you're taking high calorie thing, it is not absorbed into your body. So this mini gastric bypass surgery is a combination of restriction plus malabsorption, and after this surgery you start losing few pounds, few kilos weight every month, and it takes about 12 to 18 months to shed off all your extra weight. And with the weight coming down, so many other metabolic changes come in your body, like your insulin is controlled. There are people who have stopped taking insulin after the surgery. They have stopped. There are all anti-diabetic medicines. Your cholesterol, your triglyceride levels are normalized. Your snoring or sleep apnea goes away within few weeks of surgery. My young patients have conceived, I think just 8 months or to 1 year after the surgery. Because of surgery, even their polycystic ovarian disease, which was the cause of infertility, got corrected. So there were so many benefits attached to this mini gastric bypass thing. For this surgery, we take about 20 to 30 minutes to perform this surgery, and it's all done laparoscopically. You just apply 4 to 5 small 1 centimeter scars on your body, and after the surgery, our patients are able to take liquid diets just a few minutes after surgery and are mobilized within a few hours of surgery. So coming to the main thing, which is the diet part related to this mini gastric bypass thing, I'll be talking to Rajni. She'll tell us what type of diet is required basically after the surgery. So Rajni, what do you think when we do operate our patients? What kind of diet would you advise for an Indian patient who's not a non-vegetarian, who's a pure vegetarian patient, and what's your experience? How do they behave after the surgery, particularly the vegetarian patients after the mini gastric bypass?
Yes, it's very wonderful experience while working with this patient, the type of patients who are vegetarian, because the main focus of the surgery is proteins. We encourage our patients to take high protein diet in the form as vegetarian diet contain good amount of proteins. I always encourage my parents to go for the soya products, soya based products. There are lots of whey proteins so that they can easily fulfill their requirements of proteins. When it comes to the vegetarian part, I always encourage whole pulses, soya and soya products, curd. You can have almonds and walnuts. You can have peanut butter. These plain popcorns. All these are the very common things which contain good amount of protein. So all these products we usually consume daily on the daily basis, but people are not aware of that they are containing that much proteins. After the proper counseling, when we counsel our patients, they can easily get their proteins from these natural sources. We need not to put them on any supplements if they are following proper diet instruction.
So what do you think, how much protein should be consumed after the surgery per day?
Accordingly, we basically recommend at least 1.5 gram of protein per kg body weight after the surgery. So we plan accordingly according to the weight of the patient. We adjust the protein requirement.
So do you think whether this vegetarian diet and patient is able to get much proteins every day, and is it sufficient for them to sustain with this protein?
Yes, to the maximum extent, vegetarian diet fulfill their requirements, and in case we have to increase our protein, there are lots of whey proteins available in the market. We adjust the diet accordingly that we have some time to add protein supplements in vegetarian patient diet so that they can get their enough proteins.
And we have seen that we have operated more than 1,000 patients for mini gastric bypass. So even I will justify what she is saying, that even most of the patients, in spite of being vegetarian, do maintain good protein levels even after the surgery, even with a vegetarian diet. So there's basically not much fuss about that you should be patients who are protein deficient after the surgery. And what do you think for the non-vegetarian patients? Very easy for them to have protein?
Yes, for non-vegetarian patients, it's not a difficult part to maintain their protein levels, as we all know that animal proteins are a very good source of proteins. If they are taking eggs on the daily basis, we recommend them to take chicken, fish on daily basis so that they can easily get their protein requirement. So there is no need to get change to their diet, because non-vegetarian patients usually, if we go with the Indian population, they used to take only, they are not so fond of red meat, so we need not to cut anything like this. We always recommend them try to take eggs on regular basis. You can have egg only with the white part. You have to discard the yellow part because it contains too much of fat. So after that you can have chicken, soups, you can have fish in your daily diet, so your diet will be more enough in protein, so you need not to take any extra supplement for your protein part.
Rajni, can you tell listeners that how much one egg will have, how much proteins will they have, one chicken, one fish piece, how much proteins they will have, so that it's easy for them to know what amount of proteins. Just a rough idea for anyone to know.
Yes, definitely. If we go with the whole egg, we can say that one whole egg can provide you 6 grams of protein. But as we are discarding the yellow part, so one white egg can provide you 3.3 grams of protein. And if we go with the normal chicken serving, that is the 100 grams of chicken, that will provide you approx 12 to 15 grams of proteins. And if we go with the fish, the amount of the protein vary with the type of the fish which you are consuming. On the average, it will contain about 10 to 18 grams of protein in 100 grams of fish. So if you have all these things in your diet, in all three time of meals, you can get enough of proteins. Instead of that, obviously you are taking curd, milk and dals. These also add the extra protein in your diet.
And this, in female especially, I've seen that they're a little bit worried about some little bit of hair fall sometimes they have after the surgery. So what kind of diet do you recommend for those people, for young females?
Yes, for the young females, I always encourage them to take green leafy vegetables, as it is good source of zinc and iron, so that there is no as such deficiency for their hair fall. Instantly, I always recommend to add 10 to 12 soaked almonds and 1 walnut, so that you get the minor micronutrients. Basically, the cause of the hair fall is that the micronutrient deficiency, which most of us is unaware of that. We are used to take everything. We always want to fill our stomach with eating whatever you get. So the main focus is that I always guide our patients that you should have these small stuff, like you can have fruits and vegetables on the daily basis, and there should be proper zinc and iron in your diet so that you can avoid this hair fall.
And plus we can give them
yes, the biotin is definitely over there. We always recommend female patients so that you can, if after taking all these things you still have little bit concern about your hair fall, you can start with the biotin. That is very helpful for you.
Basically, this is an all Mediterranean kind of diet that one should have to
yes,
bypass surgery, which have more of salads and fruits, more of fiber and more of proteins, rather than carbohydrates and fats in their diet.
Basically, we always discourage, even in lean people, we can discourage that avoid taking carbs and fat. That is not good for you, even those who are not going for the surgery.
I think there should be some mixed proportion.
Yes, there should be a proper proportion that protein.
How much proteins you recommend, how much carbs, how much fats in your diet every day after the surgery? What do you say?
I think after the surgery, 70% diet should be of proteins. The rest you can adjust with the fiber part. Fiber is the important part as it gives you the slightly levels should be very full. And if you go with the carbs, yes, 10 to 20% if you can say that you get energy from your carbs and fats.
Like Indian cooking system is different from the Western. What kind of cooking oils you recommend for this Indian system so that it has doesn't have too much calories or super saturated fats? So what kind of oil you recommend for cooking?
Basically we always recommend that you should have some mixed type of oil. Basically olive oil is good for you, and you can have even coconut oil in your diet. So these both are middle chain triglycerides. These are easily absorbable in your body.
Especially the younger generation which undergoes this bariatric surgery is fond of eating some like things like chocolates and junk food and cold drinks. So what would you recommend those people? How should they change their lives, or should they keep on continuing eating all these things? What do you say?
Yes, obviously I always encourage our patients to discontinue too much of junk in their diet. Once in a while cheating is allowed. You can have once in a week, you can go with the junk food. Normally the normal homemade food is the best part. Even that will help you to live your healthy life. There's no as such we drastically changes your diet. You can have chocolates, but that should be in little amount. It is not like that you can start junk in the morning and end your day with the junk food. Then obviously after the surgery you will have to face little bit problems.
I think the main crux is if you want to maintain your weight loss after this surgery, you got to follow a good lifestyle, like eating a high, rich fiber diet, and you got to avoid this extra sweets in your diet. You have to change all your lifestyle.
Yes. Obviously, if you want to maintain your diet, even a normal person, if he or she want to maintain their normal diet, we always recommend them to take healthy diet. That should be like salads should be more in your diet, fruits should be important part of your diet, fiber should be there, proteins should be there, so that you should not feel like weakness or something like that.
Another thing I wanted to highlight about any bariatric surgery is that there should be good follow-up. Whenever patients they get operated, so it's their duty that they should be in touch with the hospital concerned regarding their blood test, which got to be done once in a year. Then there are few vitamins which you have to follow, take it regularly, and in our hospital we have made a system that we keep on email our patients that when they have gone abroad about their tests and the diet things, and I think it's both ways.
Yes.
Patient as well as a hospital, the duty of the hospital to be in touch with each other for any kind of problem.
Yes, after the surgery follow-up is very important part, because your patient always needs you whenever they have to change your lifestyle. So we are always there for our patients whenever they need us. We always reply back, or we always give them reminders. We usually used to send them emails or phone calls every month so that they can feel good and updated about their diet part and their vitamin and calcium, which should be important after the surgery.
Last thing which I wanted to highlight about the mini gastric bypass surgery is that this surgery is easily reversible, easily revisable. By reversible we means we can simply undo everything within 15 minutes. So it's not a big job. If God forbid if you are unhappy with the surgery for due to any reason, or you want to get it undone, it can be done in 15 minutes. And revising surgery means that if you have lost less than the expected weight loss, we can even revise surgery. We can make a longer bypass, make you lose more weight. And if for due to some reason you have lost more weight, we can again revise the surgery and we can shorten the length of bypass. And again, this mini gastric bypass surgery has so many exit strategies. It can be converted to any other procedure. It can be converted into gastric bypass. It can be converted to sleeve gastrectomy. So there are so many exact options with this very simple, easy to learn surgery. So this is, I think, my dietitian's advice. Then when you opt for bariatric surgery, you should know everything about that surgery and what later on diet pattern you should have, and any follow-up which is required for the surgery. You should be thorough with all those things.
And trust us guys, this surgery really works like a magic. You get a new look, a new life, new confidence, and you'll never regret in your life that you have taken such decision. So I request to all obese patients that they should get counsel about this surgery. The further decision is there. Thank you.
Thank you.